Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the scammers are after your money. Brian Roche, anchor and consumer reporter, WGAL-TV, will join me shortly to talk about that. But first, nursing homes, 81,000 Pennsylvanians are in them. What's the status? What's the needs? What's the concerns? We'll deal with that in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, as I indicated a moment ago, 81,000 Pennsylvanians are in nursing homes. There's likely to be more with the aging population that we have. Russ McDaid joins me. He's the CEO of the Pennsylvania Healthcare Association. Welcome, as always, Russ.
Thanks for having me, Terry. It's great to be here again.
Well, look, as I indicated, we got 81,000 folks that are in nursing homes. They're constantly going through, as you know, because you represent them, lots of changes all the time. Changes in facilities, changes in medical needs, changes in the budget, and we'll come to that in a minute. And there are a set of challenges that we don't think about until we need them. I mean, that's what's in, at least maybe other people do, but in my case, we just don't think about that. Go ahead.
Yeah. No, you're absolutely right, Terry. None of us think about that before we need them. And, the challenges we face, we've got this rapidly aging population here in Pennsylvania. And, we're third highest in our number of Pennsylvanians age 85 plus.
Right.
Third highest in the country. Over 400,000 Pennsylvanians age 85 plus. And that's when we really see people needing long-term care services. And the good news is the number of choices available to people is greater than ever. You can receive care in your home with home care and home health. You can get it in, kind of a mid-range facility, in a personal care home or assisted living residence, or when you really need that 24/7 skilled care that a vast majority of our members provide, we've got high-quality nursing facilities for you.
Yeah. Is this occurring primarily because of the aging, of the budget, or is it a combination of things that, these growing concerns about the need to plan, the need to have the resources to do it, or is it a combination of a whole bunch of things?
Yeah, it's a combination of a whole lot of things. It's the perfect storm. We've got this growing population of people who are at the age where they're going to need some type of services or support. 70% of us, once we get past age 65, will need some type of long-term care in our lifetime. 35% of us will spend a day of some sort in a nursing facility in our lifetime once we get past age 65. So we've got that coming at us at the same time as we're facing fiscal challenges. The baby boomers haven't necessarily saved like they maybe could have or would have. That's pretty well documented. There's some confusion about whether it's Medicaid, which is a state program that pays primarily for long-term care, or Medicare that covers care. People are confused, and that's all leading to very complicated.
It's complicated. What's fascinating is that not only do many of us not plan for it, but we also have a mindset. This is what I think is fascinating. Here's the mindset. Oh, I'll keep you. You're married. Your spouse will say, oh, you don't need to go. I'll take care of you. We're going to stay together. And that's a good thing. The problem becomes that at some point it's not always possible for a spouse, a mate, to keep a loved one, whatever the situation is, because of the need for, intensive and ongoing Am I right or wrong about that?
Yeah, absolutely. We see it every day. Our members see that every day play out, where a couple does the best that they can. They've known for a while, probably, this isn't going perfectly anymore. We got some challenges, and usually, unfortunately, it oftentimes takes a difficult event, a fall by one or the other of the members of the couple, for them to realize, we just can't handle this ourselves anymore at home. We need some help. That doesn't always mean they have to leave their home and come to a nursing facility. There are services and supports that many of our members will bring to bear as well. However, at some point, as I noted, we've got that large percentage of individuals who, whether it's because they're sicker, whether it's because they've lived an unhealthy lifestyle in the past, an unfortunate event, dementia or Alzheimer's is another key driver of nursing facility need right now. But 35% of them over the course of their lifetime lifetime will need to spend some time in a nursing facility.
Yeah, before we get to the budget in the next segment, I want to ask you about how optimistic you are, projections moving ahead. What do you think about the future, the aging population, as you talk about? People live longer, therefore they come down with, ailments and illnesses that and now the medical community, the good news is we can stay alive longer and stay healthier, but take it from there.
That's the big but. That's right. The great news is more of us are making it to 80, 85, 90, 95 than ever before. The challenge with that is that once you get to 90, 95, 100,
right, you're
going to need some type of support. We as a society have never dealt with that large a group of individuals,
right,
who needs care all at the same time. You match that with fiscal constraints at the state and federal level,
right,
and the lack of saving and the challenges that many of our elders are having right now. And I call it, we're at a crossroads, and it is, in some sorts, the perfect storm. I see opportunity, our members see opportunity, because we're really all going to come out of this and I think reinvent how we care for people.
That's a good segue into the budget situation that we're going to talk about and the budget challenges, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
I'm chatting with Russ McDaid. He's with the Pennsylvania Healthcare Association. He's, in fact, the head of that association. All right, let's chat a little bit about the fiscal needs, the budgetary situations. How much of the Pennsylvania state budget, which we won't even get into the details of that impasse, which we've done all through the last year, give us an overview of the fiscal situation with nursing homes.
Yeah, I appreciate that, Terry. And as you know, the governor just released his new state budget on February 9th, while many people are still kind of working on wrapping up, putting the final touches on the prior year, 2015-16 state budget. For nursing homes, they're heavily reliant on the state budget for their care. Over 2/3 of the care provided in our nursing homes statewide is provided
Two-thirds.
2/3, a little over 65% is provided by the state Medicaid program. So Pennsylvania's taxpayers team up with the federal government in a state-federal partnership to give care to low-income seniors who need nursing facility care. It's a big piece of what we do, and we saw a small increase in that line item this time around. We were optimistic about that. We're pleased to see that. Unfortunately, that increase has not kept pace with the increasing costs that the nursing facilities are seeing. It has not kept pace with inflation, and they still have many challenges facing them.
So so our viewers understand this, because so much of it, of the payments to nursing homes for all the services they provide, comes through Medicaid, which is jointly operated by the state and the federal government. If this if this isn't worked out, does that mean fewer people will come to the nursing homes, and or does it mean that the kinds of services that you provide will get truncated, get limited in some way, or both?
Our members do the best they can with the funding shortfall, Terry. And we've spoken before, and that shortfall is rising. Right now, in new data that we have for last year, it's over $25 a day that their Medicaid reimbursement in Pennsylvania falls short of their actual cost of providing care.
Does that mean the nursing homes have to pick this up?
The nursing homes pick up the slack. It's $9,200 a year for a bed in a nursing facility. So for a 100-bed nursing facility, that's almost $1 million shortfall from the Medicaid program that they have to pick up. And it absolutely has an impact in many things that they would like to do.
Yeah.
They put off improvements in buildings. They put off investments in technology. They are unable to pay their dedicated direct caregivers what they would like to pay them to provide the difficult care that they provide to their residents. It has a trickle-down effect to everything that our facilities do.
Yeah. So if we look, the challenges that you face then are directly related to the fiscal situation in the state. What other challenges are there?
Well, a big one is Pennsylvania's tort climate. We have one of the most difficult tort climates in the country, and you'll recall back in the early 2000s, we took care of that for nursing facilities, for hospitals and docks. We have yet to fix it for nursing facilities. So we still lack some of those protections in our tort climate that we need to see to ensure that dollars are going to patient care and not to, in many instances we see predatory out-of-state law firms who are coming in, placing ads in papers, and kind of putting a target on the backs of our dedicated men and women provided care.
All right, well look, thanks for coming in. Thanks for the update. 81,000 people, that's a lot of folks. All right, coming up, Brian Roche joins me. The scammers are out to get your money. Brian's going to help us make sure they don't.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
I enjoy it.
It's accurate.
Yep.
Well, welcome back to the program. I was chatting as we came back with Brian Roche. He's the anchor consumer reporter for WGAL-TV News 8. And I promoted this I was telling Brian, scammers are trying to get your money. They're doing this all the time, aren't they?
All the time. And still the #1 scam in the land is the IRS tax scam. They're trying to make you believe that you owe the IRS some money. Never ends. It's been going on for probably the better part of 3 years now. And most of the time they come at you over the telephone, calling you, telling you they're an IRS agent. They hit you with a fake name and a fake badge number. The funny thing is the names are often names of American male actors like Steve Martin or Dennis Quaid. And they try to make...
Now, you're kidding me.
No. They have foreign accents, but they find these American names.
And it's going to be like Steve Martin at we all Saturday Night Live in the movies, right?
Exactly. Steve Martin called me one Saturday 6 times to tell me that I owed money to the IRS, and people continue. This is where it becomes not funny. People fall for this, Terry. They pay big money thinking that the IRS is going to arrest them, garnish their wages, take their Social Security check, because these guys are very threatening, and this is not stopping, not slowing down at all.
Yeah. Now, the IRS, if they have a problem with you, are probably you're the expert, send you a letter.
Exactly. They are not. The IRS does not officially communicate with you through email or over the telephone. They are going to send you a letter to your mailbox, and they're going to ask you to get in touch with them. They will not demand immediate payment. If the situation is very serious, IRS agents will show up at your door, but they're not going to give you a courtesy call in advance.
And then they'll take out their identification, right? And
yes.
And there are ways to call the IRS, I would presume, to find out if you're under investigation. Is that correct?
That's correct. They'll ask you to come into the office. If there really is a problem with your return, if you really are being audited, they'll ask you to come into the office to have a discussion, and then they'll arrange a payment schedule if you really do owe money. But they will never call you on the phone and demand that you send the money right away.
Yeah, before we move on, I mean, you spent a lot of your professional life looking into these consumer fraud and consumer scams. That's what you do. How much of this, move away from this just for a second, is so prevalent? How much of this is going on right now? Almost every day you hear or read or see about a report?
The new statistic just came out about 10 days ago that's very telling. I don't know who did this, but the research showed there's 850 scam phone calls in this country per second. Per second, 850 per second. That's 51,000 scam phone calls a minute. You add on top of that emails and threatening letters, things like that. It's in the millions, the hundreds of millions, I would guess, per week. Probably tens of millions per day. They are non-stop because they have all this technology that they can hide behind, Terry. They can hide behind telephones that spoof the phone number. The phone number is fake.
Right.
They have technology that can spoof their computer location. So I have a computer, I can make it appear that even though I'm sitting right here with you, I can make that computer appear that I'm in Germany or Switzerland or the other side of the world. And that's why law enforcement can never track these guys down.
Yeah.
It's like trying to find a needle in 20 different haystacks.
Oh my golly. All right, now pursuing this again, what about the technology involved? And I think that's where we see a huge change as well in their ability to use technologies. Talk a little bit about that.
I was just touching on that a little bit, but they do have a phone call. A scam phone call is not actually a phone call anymore. It's actually computer generated. They get into the computer and they use technology and they make these 850 phone calls per second. And they hide behind where the computer is, as I was just saying, and they spoof the telephone number. You're not going to answer a phone call if you see that it's 1-800 blah, blah, blah. You're going to probably think that's a telemarketer. What they're doing a lot more of these days is they're spoofing a phone number in your own area code.
Right, that's right. Yeah, I've gotten those.
They get you to think that it's your neighbor calling or a friend, or maybe you think it's me calling you because you see 717. And they'll spoof that phone number just to get you to pick up the phone. And that's half the battle for them. But again, it's not a phone call. It's a computer-generated piece of technology that police can't track down.
And the other thing I've noticed is not only is it 717, but a town will come up fairly close to you as well, from Harrisburg. I mean, where we're sitting right now, or someplace in South Central PA, and you'll think, oh, this is somebody who's trying to reach me, and you don't. It's not coming from a West Coast area code or a southern, right?
Exactly. It's probably coming from the other side of the world. One new trend that we've seen in the last 4 or 5 months, they're calling you. Your name and your phone number is showing up on the caller ID. They're using that technology to show who they're calling. Now they're hoping that one of two things will happen. Either you're going to become so angry that you're going to pick up the phone and say, who is this? Or they're hoping they're going to scare you.
Yeah.
How can I be calling myself? Either way, their ultimate goal is to get you to just pick up the phone and answer your own phone call. If you have call blocking technology on your telephone, you can block maybe 25 phone numbers. But I'll bet you're not going to enter your own phone number in there to block that call coming in. That's how they get through to you.
All right, we're chatting with Brian Roche. We'll be back in a minute, and scammers are out to get your money. He's trying to help you save some of that money. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back to the program. I'm talking with Brian Roche, anchor consumer reporter for WGAL News 8. Scammers are getting your money. I keep saying that. All right, I want to get into the lottery scam, but before we do that, there's some computer technology scams that people ought to be aware of. What are they?
People are getting phone calls from people claiming to be with Microsoft or some other computer repair service telling them that there's a problem detected on their computer. They ask the victim to go into their computer and they find the error messages. Now, every single computer in the world has error messages. They look pretty ominous. They have a red exclamation mark. And to the inexperienced person, they'll say, those are all the problems with your computer. Those are the viruses.
Right.
And they ask the victim to let them into their computer. They can take over the victim's computer, lock it up, and essentially they'll say, Mr. Madonna, I can fix this computer for you if you send me $300. They're essentially holding your computer for ransom. And they target older people who don't have a lot of computer experience. You can also get a pop-up on your computer that says, there's a problem with your computer, call us and we'll fix it. But what you're really doing is opening up Pandora's box to these people. All the personal information you have in that computer, including your passwords or your bank account information or your email addresses, that could all be compromised depending upon what they do once they get in your machine.
That's why I take all my laptop and get all my computer work done at Franklin and Marshall College by the great tech people there.
That's a safe, that's a safe
I don't
thing.
touch anything.
That's good.
All right. The lottery, it's big business in this state, as you know, and you can't go anywhere and not have a machine that will sell you a lottery ticket, or go into a convenience store or whatever and get a lottery ticket. What's the lottery? How much money did I win this week?
Well, Mr. Madonna, you may have just won $100 million. Isn't that fantastic? All you need to do is send us a $3,000 check to get your lottery winnings. And that's the scam. And so many people call me literally every single day saying, is this real? I tell them all, I wish it were, but it's not. You never have to pay money to get money. If you really did win a lottery, I ask people, where did you buy the ticket? If you didn't buy a ticket,
well, hold on
you can't
a minute.
win.
I mean, are you telling me that people who didn't buy a lottery ticket think
they won?
You know where I'm heading with this. I can't even get it out.
They're told that their email address was randomly selected by someone on the other side of the world, and you just won $100 million. Or fill in the blank. One of the most common scams we hear lately is, you've won $2 million and a Mercedes-Benz, and if you just send us the taxes up front, $3,000, $2,000, we'll make sure that you get your $2.5 million and your Mercedes-Benz. If you send this money away, it's gone. It's just
I
gone.
would tell them, put the Mercedes in front of my house and leave the keys in it, and then I'll talk to you. Does that work?
Most people do exactly that. But what these scammers are looking for, Terry, is that 3 or 4 or 5% of the people who will believe this. And if they call 100 people in a day and they get 2 or 3 people to believe this, they can walk home with $6,000 to $10,000 in one day.
God.
That's not bad for one day's work.
No.
But people will fall for this.
All right, we have about a minute left. I want you to give me 2 or 3 helpful hints for the folks out there. How to beware, what to beware.
When you get a phone call anymore, be very wary of it. If you don't recognize the number, do not answer the phone, because we go back to this technology I was talking about before. When you answer the phone, you're not dealing with a human being. You're dealing with a machine. On the other end of the machine, the other end of the phone, I should say, the machine says, someone answered this phone.
A live person.
It's a live person.
Not the robot.
Exactly. The machine says, I'm going to call this number back because there's someone there. So that's why we constantly tell people, don't answer the phone if you do not recognize the number. I wish I had a better solution for you right now, but that's the best thing we can do to stop these calls.
Now, occasionally I get things in the mail, solicitations in the mail, or enter this, or are they as problematic?
Yes. Well, essentially, they, again, want you to send $20 to enter this sweepstakes. And if you respond to it, you're going to do 2 things. You're going to lose $20, and your name and your address is going to go on what we call a suckers list. They're going to say, Terry Madonna responded to this once, so let's send him 5 more.
You got it. Hey, Brian, great update. Thanks for coming in. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well. And you stay here. Let's go.
I got it.